Welcome to The Explainer. Today we're talking about something really serious, an obstetric emergency where every single second counts. It's called placental abruption. So let's just dive right in and talk about what exactly that is.
Okay, so placental abruption. This is no minor issue. We're talking about the moment the placenta, the baby's literal life support system, starts to separate from the wall of the uterus way too early. It's a really critical situation that needs immediate medical attention, because honestly, time is everything here.
So to really get a handle on why this is so dangerous, you've got to understand what the placenta actually does. I mean, it's the fetus's lifeline. It's the one and only source for all its oxygen, all its nutrients. Everything it needs to grow comes from the mother, through the placenta. It is, quite literally, everything.
And this slide just lays it out so clearly. Look over on the left, that's what a normal, healthy attachment looks like. The placenta is snug against the uterine wall, everything's flowing smoothly. But then you look to the right, that's the abruption. That critical connection has been broken. And it doesn't matter if it's just a little bit or the whole thing, that lifeline is officially in danger, and that puts both the mother and the baby at serious risk.
Okay, so what should you be looking for? What are the key warning signs? Knowing these can be, and I mean this, life-saving.
All right, here are the most common symptoms. You've got vaginal bleeding, but, and this is so important, see that note there? It can be absent. That's huge. Then there's sudden pain in the abdomen or back, the uterus feeling really tender or even hard, and rapid contractions. Oh, and a big one, if the baby stops moving as much. These are all massive red flags. The main takeaway here, you can't just hang your hat on one symptom, especially not the bleeding.
It's so easy to think that the amount of bleeding tells the whole story, right? A little bit of blood, maybe it's not so bad. A lot of blood, okay, it's a huge problem. Well, with placental abruption, that kind of thinking is actually really dangerous. The amount of blood you can physically see might have nothing to do with how bad the situation really is.
And this table explains exactly why that is. You've got two types. A revealed bleed is what you'd expect. You can see the blood. But a concealed bleed, this is where things get really scary. The blood is trapped behind the placenta. It has nowhere to go. So a person can be bleeding massively on the inside, losing enough blood to go into shock with almost no outward signs. It can become a full-blown crisis before anyone even sees a drop of blood.
So are there things that make this more likely to happen? Absolutely. We're talking about major risk factors like hypertension or preeclampsia or any kind of direct trauma to the abdomen, like from a car accident or a fall. Smoking and cocaine use are also on the list, and a really big one is if you've had an abruption before. It's often a mix of these kinds of ongoing health issues and sudden events that can create the perfect storm for this emergency.
And we need to be really clear. This is about so much more than just pain and bleeding. We're talking about a whole cascade of complications that can be absolutely devastating for both the mother and the baby. So let's talk about why this is a true, life-threatening emergency.
Okay, for the mother, the number one danger is massive blood loss. That can lead to something called hemorrhagic shock. And from there, it can trigger a terrifying condition known as DIC, where your entire blood clotting system just goes haywire. This can spiral into organ failure, like acute kidney failure. It's a full-body crisis that demands a huge medical response.
And for the baby, well, the danger is just as serious. Remember that lifeline we talked about? When it gets cut off, so does the oxygen. That's called hypoxia. This can force an immediate preterm birth, and in the worst, most tragic cases, it can lead to stillbirth. Every single second is about trying to get that oxygen supply back, and usually, the only way to do that is to deliver the baby immediately.
So, knowing how severe this is, what happens next? Let's look at the emergency response, because when doctors suspect an abruption, they have to move fast. Now, there's no single playbook for this. It really depends. Doctors have to balance how bad the separation is with how far along the pregnancy is. If it's a pretty mild case and it's still early, they might just monitor you very closely in the hospital. But if it's severe, or if either the mom or the baby is in distress, the game plan changes completely. The goal becomes one thing and one thing only: deliver the baby.
And this really breaks down the emergency priorities. First, you have to recognize the signs we just talked about, that sudden pain, the rigid uterus. Then, and this is so critical, you have to get help, immediately. Treat it like the 5-alarm fire it is. Once the medical teams arrive, they're going to be all about speed, getting to the hospital fast, watching for any signs of shock, and getting ready for what's almost always the final step, an emergency delivery, usually by C-section.
So if you take away just one thing from all of this, let it be this sentence right here. It's the whole crisis boiled down. The placenta tears away early, that causes pain and bleeding, which then leads to oxygen deprivation for the fetus and hemorrhage for the mother. And the bottom line is simple. You have to treat this as an obstetric emergency, every single time. And that really brings us to the most important question, doesn't it? In a crisis, would you know what to do? Because this is more than just learning medical facts. It's about being prepared. Understanding these signs, that sudden, sharp pain, the hard abdomen, and especially knowing that you might not even see any bleeding, and knowing that the only right answer is to get help right now, that knowledge can make all the difference in the world.